Okay, Claire, take it away.
Good morning, everybody. Welcome. It is Wednesday, January 26, 2022. It's 10 a.m. and this is the regular weekly meeting of the Lincoln County Board of Commissioners, which is being conducted virtually via Zoom. All three commissioners, myself, Doug Hunt and Katie Jacobson, are present, which constitutes a quorum of the board. Our first agenda item is the adoption of the consent calendar. These items are routine or they have been discussed at previous meetings. Are there any items that commissioners or staff wish to either highlight or remove?
I'll move for approval of the consent calendar as presented.
And I will second the motion.
Okay, we have a motion and a second for approval of the consent calendar. All in favor, please say aye.
Aye.
Aye. Okay. And now we do not have a public hearing this week. We move on to decision and action. Human Resources Director David Collier will be joining us. Do we have David online, I believe?
I am here.
Okay, this
Chair
was introduced last week, and based on some feedback from the board, David has brought us a revised document. Can you briefly summarize for us what the concept is here and what specific change you've made to the proposal we looked at last week?
You bet. Thank you, Chair Hall and Commissioners. Again, for the record, I'm David Collier, Human Resources Director for Lincoln County. Last week, I presented a proposal to change the process, the requisition process for replacements for identical positions. We had some conversations to change that proposal a little bit. The group of other department heads, we conversed via email and talked about it, and we also agreed with your assessment. So, in skipping going over all of rehashing everything, basically the proposal for the identical replacements would be that, again, the requisition would originate in the requisitioning department. It would go to that department head, and then it would go to the county administrator, again, once that person is on board, and then it would go to Human Resources for posting. In the interim, while we don't have a county administrator, the commissioner that is the liaison for that department, it would go to them for approval and to the chair for the elected officials. So basically, you would all have the directors that you have, and Chair Hall, you would also take on the elected officials in this time period until we have a county administrator on board. Again, this would eliminate a number of signatures. It would speed up this process and allow us to get positions posted, quicker, so that we can get them out there, again, in this tight labor market. So, any questions?
Commissioner Hunt, Commissioner Jacobson, let's see, I see Commissioner Hunt's microphone is live, so I'll turn to him.
Well, I was preparing to either make a motion, but I will comment that I continue to emphasize the fact that when we say, a formal request for an identical replacement, I continue to feel that anytime we have an opening, it's incumbent upon the department director, the HR department, and ultimately, I guess, the county administrator or we as commissioners to make sure that there's really some discussion as to, are there alternate ways, better ways that we can structure the department, structure this job position to improve the efficiency and be cost effective. So.
I have kind of a clarifying question. So reading on the red here, it said it would go to the county administrator once they are on board. Until then, it would go to the commissioner that is the liaison for that department, or the chair for elected officials. And I guess I'm not clear which it is, because it says, or you kind of talked about, David, about it going to the chair. So is that what we have a consensus on as we go to the chair? And if the chair is not available, it goes to the liaison, or?
No, so I guess I was meaning, so it would go to the liaison for that department, but my understanding is the elected officials don't have a commissioner liaison. So for them, it would go to the
okay.
chair. Sorry, maybe my.
Nope, I
No.
wasn't reading that right either. Okay, thank you. I got it.
You're so welcome.
Communication's a fine art.
I was just reading what he said in a different way, so I get it now. Thanks.
You're welcome.
Any other commissioner feedback? If not, I would entertain a motion.
I'll move for approval of the revised requisition process for identical replacements.
I'll second the motion.
Okay, we have a motion and a second. All in favor, please say aye.
Aye.
Aye. And it is approved. Nothing under discussion and information this week, so we move to reports. We have our weekly COVID-19 and vaccination update from Public Health Director Florence Portal. Also joining us this week is Dr. Leslie Ogden, CEO of the 2 hospitals in Lincoln County. And then after that, we'll be hearing from Sheriff Curtis Landers. But Florence, please take it away.
Good morning, commissioners and everybody. Good to see you all. So I'm staying with like the theme that I started last week. This is a graph showing COVID cases per 100,000 per week in the state of Oregon. This is from the latest DriveThru report that the Oregon Health Authorities put together. And as clearly expressed in that graph, you can see that unvaccinated folks are making a very large bulk of this surge. Obviously, there is a little bit of a breakthrough uptick, and this is the reason why we've been pushing for getting yourself up to date through booster as soon as you're eligible. But you can still see a dramatic difference in the case numbers between vaccinated and unvaccinated people. Next slide, please. So, highlight of the weeks, and obviously, Leslie, I'm gonna let you do the hospital updates. So, COVID cases, well, I believe we're about double what we thought was the highest we would ever seen last summer. So as of this morning, we were at 1,680 cases. As a reminder, those are only the cases that are reported to us, okay? So even though we have a system in place for people to report at-home test results through our website, the CDC is pretty much putting out there that it's likely that this is only about 25% of the actual case count. And the transmission is through the roof in the county like it is in the state. So, you know, it is possible that either people do not get tested, or, you know, they have symptoms, they think, oh, I might just have a cold, or they get tested, but it's an at-home test kit and they're not reporting the results. So this is why we're really, I'm thinking at least double that and possibly 4 times that. So the Oregon Health and Science University came up with a latest model, I believe last week. And this link is hyperlinked. So if people want to access the report, you can just click on this, and that's going to give you the data and the slide deck. But pretty much it looks like the cases are going to peak this week and possibly next. And then hopefully hospitalization, you know, will be peaking soon. And what that means that it's going to go down at some point. So, but Dr. Ogden is going to tell us more about this. On the vaccination front, if you're not up to date on your vaccination yet, please go get a booster. There is plenty of information and plenty of clinics available to you, and we're trying to make them come close to where you live. So call the call center if you need information. Go onto our website. There is an updated calendar in there. Just a few other facts. So for people who have been vaccinated with the primary series, the booster shot gets you protection against Omicron from 35% to 75%. So it really makes sense, right, to go get boosted so that your immunity flares up a little bit. Remember that vaccines is not 100% protection, but what they do is that they will likely make the illness, if you're getting sick with COVID, milder than it would have been either without vaccination at all, or even with just the primary series under your belt. So boosting is really recommended. We're sending a mailer out to everyone in Lincoln County to really discuss this. So expect to see that mailer in your mailboxes likely next week. Like I said, we have clinics available without appointment throughout the county. And the other thing also to discuss is that if you're not up to date on your vaccination, you will have to quarantine if you're exposed. If you're up to date, you don't have to. Next slide.
So before you move on, Florence, I'm not sure I understand the second bullet point under cases. The last line there, do not get tested even if they have SX. Symptoms. Okay, then I guess my other question is, if I'm reading that right, and again, communication's a fine art, if we're only seeing 25% of the actual case count, and our case count is 1,600, that means in reality, we have over 6,500 cases?
Possibly.
Well, that's a big difference.
Yeah, it's huge. But so remember that the data we get is—
No, I understand that. I'm just saying that if that 1,600 is 25% of the cases, then in reality, our county has over 6,500 cases, which, if my math does me well, is about more than 10% of the population.
Correct.
That's a sobering set of numbers.
Yes, sir. Next slide. Okay, so this is the epi curve. So OHA doesn't necessarily always update their slides as fast as we would like to, but this is kind of where we were at on Monday morning. 19,000 new cases over the weekend. Hospitalization are raising, positivity rate almost 5 times what we would like it to be. So next slide. And next slide. Oh, actually, I wonder, Dr. Ogden, do you want to take those? I mean, and then you can talk to us all you want about hospitalization, but I think that would be great if you wanted to jump in on what's going on.
Yeah, absolutely. So what we're seeing across our hospitals is fairly stable. We have not reached the height that we had with Delta as far as hospitalizations contiguously, across both of our hospitals. But what we're seeing now is a little bit different in that across the state, we're really getting we're really getting close to what we saw with Delta. And then we're predicting to be even higher than we saw with the Delta curve. So our updates again, across the state for Monday, we saw that hospitalizations had risen from 897 the week before to over 1,072. And if you'll recall, we peaked at about 1,200. So that is expecting to hit sometime this week. You know, why do we care so much if our hospitalizations are okay within the county? We care because we can't move patients to a higher level of care. These patients are now boarding in our ERs. We have anywhere from 1 to 4 or 5 patients at any time has become the norm. And we've struggled both with timely transport because the transport agencies are having difficulty with their staffing, as well as finding beds. And the struggle is not over. Obviously, it's going to get worse. So, so we're coming up with alternatives on how to really mitigate this, you know, because we're going to have to become the answer for ourselves. We are becoming rapidly our own islands. So I can talk about that more, but again, it's not because of COVID patients this time. It's, you know, in our hospitals, it's because of COVID patients and every other type of patients that's overwhelming, you know, the system across the state.
Dr. Ogden, question or two, if I might. You know, I've been reading in news coverage, an interview with the president of the state hospital association, where she talks about the issue of boarding and not only being able to, I get the impression it's a challenge not only to be able to transfer people to other hospital level care they need, but that people, you know, you end up, for example, if I'm understanding correctly, boarding those people in the emergency rooms because like the nursing homes and other skilled care facilities that would normally be their step down from full hospital care, they don't have the capacity needed to accept new patients. Is that true?
That is absolutely true. And that was true to some extent even before the pandemic. We have very few facilities in our region to discharge patients to. And they, especially in a rural area, they struggled with staffing, you know, before this ever happened. But now they are at really an impasse where they cannot accept any more people because of their own staffing issues that are being dramatically affected by the Omicron surge as they lose staff members. So they've basically frozen most of our discharge facilities have frozen acceptance of any new patients. And so then they become ours in the hospital as well, even though they no longer require hospitalization. So you're exactly right. That is a big problem with patient movement. We just cannot move them like we used to.
One more question, if I could, as long as this article also talks about OHA, the Oregon Health Authority, contracting with temporary workers and making them available to local facilities, as well as assignment of National Guard members to certain duties. Have you had to utilize either of those resources, or do you foresee a scenario where you would have to do that?
Yes, we have made a request for clinical staff from the OHA to please help us, because the same thing is happening to our staff now that is happening to others. Despite our 96% vaccination rate at both of our hospitals, this particular variant, of course, is taking down our staff, whereas Delta did not in quite the same way. So even though our staff aren't getting critically ill, So I don't want to diminish the importance of vaccination. These people are having mild cases of COVID by and large because they are fully vaccinated, but that doesn't mean that they don't have to be off work, or when their family members get sick, that they don't have to take off time to care for them. And so, what we're finding is that we don't have the amount of staff to be able to continue our current level of services. So last week, we did make a request to the OHA, and within a couple of days, we got word that our staffing requests were received and they were being honored. And so now we are working at North Lincoln with Maxim healthcare staffing, and at PCH with Ogden healthcare staffing to fulfill our request for 26 and 32 staff members respectively. Most are nurses, but at North Lincoln in particular, we have asked also for physicians and advanced practice providers, either nurse practitioners or PAs, because of staffing gaps that we cannot fill. So we are looking at receiving those additional staff members as early as February 1st, but sometime during next week, we hope to start receiving them in a rolling fashion. Of course, these are national healthcare agencies, and they are experiencing some of the same problems that we are with finding people. So we agreed, as soon as they find someone, verify their licensure, do the quick background checks, and make sure that they have everything they need to come to us, that we will take them in that rolling fashion, that we will not have an all or nothing. We'll take whatever they have. We have heard from other hospitals who have requested a lot of people that almost no one has shown up in the end. And so we certainly hope that that is not the case with us, and we have every reason to feel hopeful. As far as the non-clinical staffing requests, we are still working with OHA to figure out where are the National Guard people, are the additional ones, especially that the governor called up, are those available for these non-clinical positions that we have? And we have approximately 15 positions at each of our hospitals, everyone from entrance screeners to housekeepers to nutrition workers, that work in the kitchen. We have all those people out as well, and we do need those positions. So we are still working with them. If we cannot get any sort of response from the OHA as far as finding those non-clinical positions, we do have something that we are implementing within Samaritan, which is taking our corporate workers that can it be spared at all. And of course, this will grind everything in the background to a halt, but if that's what we need to do, we'll do it. So we do have, a number of our approximately 1,000 corporate workers on the back end that have agreed to help us if we absolutely, have no other resources, and they can come out and, learn these jobs and help what they can.
Wow. Thank you for all this information. Pretty sobering, to say the least.
Yes, it is.
All right, thank you, Dr. Ogden. If there are no questions for Leslie, let's move on to some of the next slides. Casey, please. You can move on. Okay, so obviously this is already obsolete. So yesterday we were at 1,594 cases. This morning we were at 1,680 cases. We've seen about an average of 100 cases a day. We're ranging from 70 to 200. So look at our incidence rate. It's always amazing, and like to see how much, new cases per 100,000 we can get to. So as of, and I'm so sorry, it was week of the 24th. The 17th, sorry, never mind. Because this is based on last week data, 1,364 cases per 100,000. 6 times over what the extreme risk category was last year. 25.6% test positivity, which is more than 5 times what we would like to see at the most. Next slide.
Florence, I'm sorry, this is Doug. Back to that slide. And again, not to belabor the point that I made earlier, but I believe, correct me if I'm wrong, that as you look at those numbers as home testing and breakthrough cases have become more predominant in the recent months, those numbers are, the more recent numbers are significantly below what we think is the reality compared to what was being reported last summer. Said differently, the summer numbers may be fairly accurate, but the more recent numbers, as we discussed earlier, are really relatively low compared to what we believe to be reality.
That's correct. I don't think it has anything to do with breakthrough cases, though. I think it has to do with either people not being tested even though they have symptoms, or people being tested at home with a home test kit and not reporting that test. So the data we can work from is only the data we're getting a test result we're getting a report about. Okay,
Yeah,
so this
no,
is,
I'm sorry. I finish.
Yeah. No, so yeah, there are likely way more cases than we are seeing with the data we are working with currently. Correct.
Yeah, my comments were not meant at all to be a reflection on public health or I guess issues with collecting the data. It's simply saying that the reality of the situation that we're living in, not all cases are getting reported, and therefore not all are reflected in the data.
Yeah, this system for reporting is absolutely not set for any reportable disease to be able to handle at home tests.
Yep.
So we have the system set up as a Oregon-wide system for the laboratories to talk to us, for the primary care offices, the hospitals to talk to us, and report based on the reporting requirements. But this introduction of test kits really throws a wrench in what we have available to us at this particular time, and exposes some of the challenges that the system has been facing during this pandemic. So
well, the reality is that I think I'm safe in saying that all counties are facing that same challenge. Therefore, the underreporting, if you will, is a factor in all of the data throughout all of our counties.
Mm-hmm. Yeah, we only know what we know, and there is a lot that we don't know. Is I think what we can.
I think I've belabored that point enough.
Yes. Okay. Next slide. Okay, so this is just our reports of COVID cases per week. Well, you can definitely see that we've been, our epi curve is definitely trending upwards and still trending upwards, maybe slowing down a little bit, but we'll be able to see next week if we're starting to plateau or not. Next slide. Okay, so this is what we talked about last week. So those are a comparison in cases reported to us by year. Okay, so blue is 2020, red is 2021, and yellow is 2022. Okay, remember when we thought, oh my goodness, we had this larger outbreak in June of 2020, we had 305 cases that month. And then when in August, we were like, oh my goodness, Delta, this is so wild, 785. We're not even at the end of the month and we've already passed the 1600, okay, for January. So this is very interesting. I feel like to put things in perspective. The really good perspective to have as well is that in 2020, we did not have really a lot of protective measures, and now we have them, especially against severe disease and hospitalization. So back to the spiel around being vaccinated and boosted if you're eligible. You know, we can still up our boosting rates. We are in the low 40% right now, and the 5 to 11-year-old, even like the 5 to 17-year-old, we're in about 35%. I think we can do better than that. Next slide. Okay, but this is what I was talking about. I was even generous, really, for the 5 to 11. We're at 23%. So it would be really great to increase that quite a bit. And you can go to the next slide. We're working with the school districts to set up some clinics. So we have some tentative dates. So this is why they're in green for school clinics. So the goal is to have clinics for elementary, middle, and high school prior to spring break. And then we want to do the same thing prior to summer break. As you can see, we have plenty of clinics going on. So really people have a lot of access at this time. We are finalizing also the testing distribution. So we've identified a list of partners and are outreaching to them. We have finalized our ordering process with each. So we're taking the opportunity of test kit distribution to provide some education and information, both to the partner that is going to be distributing those kits and to the people who are going to receive those kits. So I think this is going to be really exciting. So we have placed the order about 2 weeks ago, and I haven't heard from OHA yet as to when we're going to receive them, but we will be ready for when the tests are here to be able to distribute them. The focus has to be on populations who are having a hard time getting to testing. So this is what we've been doing. Next slide.
Oh, could I inject something here quickly?
Yes.
A little bit of good news about the federal test kit distribution. One of the staff here in the Board of Commissioners office placed her order online last week and received her 4 tests yesterday. So
wonderful. Wonderful. Yeah, I did that myself last week. So
great.
Probably coming soon. Excellent. So, you know, kind of the old same old, but this is what we can do to reduce COVID transmission, right? And protect each other. So getting vaccinated and making sure that we are up to date on our vaccination is important. Wearing a mask in public settings, indoor, limiting social gathering. And when you gather, maintain social distance if you can. Stay home when you're sick and get tested if you can. Pretty much that will be in French, we say the sound of the bell that we're going to be ringing for quite some time. So that's what I've got for you this week.
Okay, thank you, Florence. And let's ask Dr. Ogden if she has additional information to present, and then we'll open things up for questions for both of them, if that's okay.
Yes, absolutely. I actually have a presentation if Casey
Great.
can give me the rights to show that.
Okay, stand by, Leslie. I am handing over the power to you. You should have it.
Okay, hopefully
Yeah, looks good.
you are seeing that. Okay. Okay, let me just run through this. Basically wanted to talk a little bit about the pandemic, and of course I'll skip over what we've already talked about, but just make sure you're up to date with everything going on with the hospitals, and then just give a little bit of general update, which will hopefully be a bright spot to end this with. So we talked earlier about our inpatient situation, and what you are seeing on the graph is exactly that playing out over our 2 hospitals. So you can see back in September when we had our peak with Delta that we're just not quite there, you know, but again, it's not what we're so worried about this time, because what we're seeing more of this time are people going to lower levels of care, increased volumes, but going to lower levels of care, like our walk-in clinics, even our ERs are getting more inundated with people seeking care and testing. And then that results in transfer difficulties because, you know, if someone should need to be transferred, then we have difficulty getting them out. So it's just increased volumes all the way around in sort of a perfect storm. One of the tools I wanted you to be aware of, and you probably saw the FDA announcement, but one of the tools we had before was monoclonal antibody administration. And that was basically after someone became infected, if they were at risk of having a severe outcome, we could administer monoclonal antibodies to them, basically giving them the antibodies that they would have gotten, you know, should they have gotten vaccinated and made those antibodies themselves. Part of the problem with Omicron is that out of the 3 different formulations, only one is effective against this particular variant. So the FDA has now asked us not to give anything but that one. Of course, that particular monoclonal antibody is not readily available in a lot of cases. And so we've had shortages, and it really has ground our monoclonal antibody administration really to a halt. I mean, we will do what we can, and we will give it when we have it, but it's not readily available like it used to be. How we are handling our challenges is really doing bed huddles multiple times per day, trying to find out, can we stretch our own resources and take care of patients that maybe we would have transferred otherwise. We have stopped surgeries or postponed surgeries at different times. You know, if we need to move staff around, and we have moved staff from some exotic locations as well, if we have those available. So we're doing whatever we can to bridge gaps. One thing that you will likely see us do next week at North Lincoln is we will be stopping most of our surgeries and using that area as overflow for some of these patients that we can't move, either in the emergency department or like Commissioner Hall referenced, people we cannot discharge to the care facilities that they need to go to, long-term care facilities. So that is one thing we've come up with, is a way of really expanding our ability to take care of additional patients. So it's sort of a surge, but it's a different type of surge that we did not really plan for in quite that way, but it's going to work because, we have to make it work. So you will see some sort of innovative thoughts there, and we'll try all different types of ideas that we can come up with to see what works for us. A lot of people are questioning, the breakthrough hospitalizations and saying, are the vaccinations as good, as they used to be, things like that. This is actually some data for our entire hospital system, so all 5 hospitals. What you should pay attention to is that darker purple that is representative of the breakthrough hospitalizations versus the lighter above it, those that are unvaccinated. So yes, we are seeing the darker purple, people who are fully vaccinated becoming hospitalized, but it's along the numbers, the lines of like 10 additional percent of people. So right now we're looking at about 15% of those who are hospitalized being fully vaccinated versus the 85% that are unvaccinated. So while we are seeing more, it's still, the data is very much pointing to you need your vaccinations, and that will help tremendously. If we look at our drive-through testing sites, you may well be aware that we have had to go to appointment only at our drive-through testing sites. We really wanted to keep them as open as possible, just as many people as possible. But on January 10th, we hit a situation that we could not sustain the volumes. And so on January 11th, we went to appointment only. It was a little bit rocky for some people. Lots of people were not happy. And I totally agree with them. I wish we could have done it differently, but this has allowed us to keep our head above water and continue to provide almost at that level of volume anyway. It's just, it doesn't come, where it just deluges us, where with everyone coming at the same time and the line of cars being wrapped around, out to Highway 101 sort of thing. So we are continuing with lots of testing, a sort of record-setting volumes of testing, but we've got it under control now, and we aren't being overwhelmed. So we'll continue with that, and as soon as we feel like we're able to, we'll open it back up, because again, we don't like the idea of only booking people for appointments for this testing. We want testing to be as open as possible. As far as employee vaccinations, I already mentioned that we are 96% at both hospitals. That's where we landed. But regardless, we are still seeing an awful lot of like double digits of our staff members at each hospital each day sort of out with COVID. And so we are leading our entire system, but it is just something that's happening different with this surge. We did go to a universal mask change policy. This is also something that a lot of people aren't real popular. It's not a real popular decision, but it's the right decision. So basically what we're saying is that all patients in our facilities must wear a medical grade face mask. And for them, the lowest level of that is a procedural mask with the ear loops. And if they don't have one, then we'll provide one, but we no longer allow bandanas or gaiters or cloth masks or anything that's less than that medical grade face mask. What we're also saying is that all of our staff that work in these clinical buildings must wear a designated N95 or KN95 mask. And the reason is exactly what this little graph is showing you, where if a person is infected and wearing one of these masks along the left side, and the person who's not infected is wearing, one of these masks along the top row there, we can get, if we look at that infected person wearing a surgical mask and our person wearing an N95, we can get up to 5 hours of exposure without, getting transmissibility. Now, this was pre-Omicron data, and we do acknowledge that this may well be changed now, but I think the idea still holds that the better the mask on both parties, the safer we will all be. And particularly not knowing who has it sometimes now, with lots more asymptomatic or mildly symptomatic cases out there, and the increased transmissibility, that's of course what we're seeing. I wanted to just talk with you a little bit about crisis staffing. Of course, we are already talked about the OHA staffing. So crisis staffing is basically a phenomenon where we will bring back asymptomatic or slightly symptomatic workers who are able to work and agree to work despite their having a COVID positive diagnosis. We are getting to that point where we are going to have to do that. The OHA has asked if we do that, of course, that we disclose to patients, and we will do so, and that we disclose to one another within our institution that we are doing that. So all healthcare workers are alerted as well. I wanted to just clarify that we are not moving to crisis care guidelines. We are not exhausting all of our resources across a system. We are not rationing care. What we are trying to do is simply have enough people in various particular areas. And let me give you an example. We were able to avoid crisis staffing in this instance, but we got this close to doing it. At North Lincoln, we have 3 obstetricians. One is out on maternity leave as of this last weekend. One is COVID positive, and that leaves us 1 OBGYN to handle everything. So the person who, the obstetrician who is COVID positive is now going on like day 6 or 7. She remains asymptomatic as of the last few days, but continues to test positive. And in that case, we were thinking, I don't think we have any other option other than to bring her back, have her, of course, wear the highest level of PPE and never break that and disclose to patients, that was the scenario. Luckily, however, we were able to find an OBGYN at one of our other sites who could swoop in and provide some emergent help. So we did not have to go there. But we're running into those situations more and more where people are able to work, they want to work, but because of residual, test, results that are showing even after their symptoms have resolved that they are still COVID positive, we're not able to bring them back unless we go to crisis staffing. So many hospitals around the state have already done this, including some of our own Samaritan hospitals, but we have not done so on the coast yet. And so we will likely be pursuing those department by department, situation by situation, and not across the board. And then, of course, you see our OHA clinical staffing request, and we'll expect to see those next week. We hope, fingers crossed. Just to bring some light at the end of our tunnel, we know that this is temporary, that we will get through the surge, and we are working to expand some of our service lines. And of course, we'll get back on this focus once we have everybody back to work and we're not dealing with the surge. But we're seeing endocrinology expansion. That was at PCH. We've seen that happen over the past 6 months, but coming soon also to North Lincoln. We have palliative care startup at North Lincoln. We have infectious disease now once again back out at PCH. That stopped during most of the pandemic because our infectious disease doctors were dealing with the pandemic. But we've restarted that. Hematology and oncology, we have a new permanent provider at PCH, and we are expanding days at North Lincoln. And then through our nephrology dialysis partner, we have moved away from Fresenius and are now with DaVita, and they have upgraded the Newport Outpatient Dialysis Center with all new equipment. It was not as smooth as we would have liked it, meaning we would have liked one day Fresenius to be in that place and the next day DaVita, and no disruption to service. But we did have a couple of weeks of a couple of months of disruption, but now they are back open and operational with that very much needed upgrade. And so we were glad they were able to do that. As far as hospital service lines, we are extending our PET-CT services to PCH, and they previously have not had that service line for as long as I can remember anyway. We'll be expanding days at both sites. And PET-CT is largely used for cancer diagnosis and staging. And so that is great for our population. We have oral health services through a grant that are now being provided across North Lincoln in our ER and in our inpatient units. And in March, we'll see those start at PCH as well. And then we have done some surgery expansion that I'll show you. This is our data from last year. And so at North Lincoln, we saw about a little over 13% increase in surgery volumes. And then at Samaritan Pacific Communities Hospital, a little bit over 15%. And we're hoping to continue to make sure that we take care of patients in our communities. And we're very happy to see that. Volumes were largely due to expansion in orthopedics, some general surgery expansion, and some ophthalmologic surgery expansion. And then just miscellaneous, you may well be aware, but we had Sam Jones as our VP of Patient Care Services over both hospitals, and that was becoming an untenable situation with the pandemic ongoing. So we divided those jobs back out. Sam is back at his home institution at PCH, and Denise Moland has come to us from scads of experience across multiple states. And she last was in New York, actually serving during the pandemic. And so we are happy to have her now in a much safer part of the country, I think, but with greater expertise at that patient care services level. We also are on track with our family medicine rural training track to start that. Our residents will start this summer, and they will do their first year in Corvallis, Portland, Eugene, all of those large markets. And they will come then, starting in 2023, we will have family medicine residents, so doctors training on the coast. And every year thereafter, we will see more and more of them. We are on a journey to become a highly reliable organization where we are able to get to zero patient harm. That is our goal, and we are uncompromised in that, but that is going to take a lot of education and a lot of work with our processes. So,
Dr. Ogden, sorry to interrupt, but just can you tell us what that term means?
Yeah, so basically, becoming a highly reliable organization means that we take risky scenarios, an industry such as the airline industry or nuclear medicine or medical healthcare, and we know that it is a high risk environment, and we change our processes to mitigate that risk, and while still accommodating the complexity of what is there. So basically it's studying our processes, it's reporting whenever we think there's a risk that's there, and it's really changing our organization so that we can get to zero patient harm. So it's what you've seen the airline industry do, where they were prone to crashes, and then gradually over time they were able to change so that a crash is a rarity, almost never even spoken of now. And so we hope to do the same for our medical facilities here in Lincoln County and throughout Samaritan. We are once again focused on Coastal STARS, which is the Substance Treatment and Rehabilitation Center. Just like the one that's in Lebanon, we are fast trying to make one happen on the Lincoln County coast. And we need it just as much as Lynn County does. So we are working on that. We have heard for many years patients express their problems and issues with calling our call center and not being happy with the outcome. And so we have done some software upgrades, and we are investing in additional training with our folks there and hoping to solve some of those problems that we know are very real. We continue to pursue affordable housing, especially in the Lincoln City area that is most acute need after the wildfires. And we have some things that we're working with the city of Lincoln City to identify opportunities. And then lastly, we have a partnership with Coastal Phoenix Rising that many people know about that has just really changed some of our situations where we had to discharge patients to the streets. And now we have a safe place where they can continue to get some medical respite care while they recover after discharge. So we are really happy with our partnership with them. And then lastly, I just want to advertise a little bit of our awards and recognition from last year. We were identified by the Lown Institute as both of our hospitals as in the top 3 in the state in our social accountability and responsibility to our communities. And so we were given that honor. Our PCH hospital, once again, got the 2020 American Heart Association recognition for our treatment of strokes with a Gold Plus category. I completed myself the NRHA Rural Hospital CEO training. So you now have a certified rural hospital CEO. And then lastly, both Dr. Erling Oxenholt and myself were honored to receive awards from the state of Oregon that were given to a rural healthcare hero. That was what Dr. Oxenholt won. And I was awarded the Oregon Community Star Award from the National Rural Hospital Association. So we had a wonderful year despite the pandemic, and I hope that's a great way, of course, to end the show here.
Oh, thank you. Oh,
I was going to say, let me stop sharing and ask if there's questions.
okay. Questions for Dr. Ogden or for Florence about this week's report? Commissioner Jacobson.
Well, first of all, congratulations, Dr. Ogden, on your award. You know, we would have wrote you a letter of support had we known you were being considered, but really glad to see that you got some recognition for all the hard work that you have put in here in our community. So I'm glad to see you receive that. One question I had is when you were talking about the vaccination status of your staff, which is great to see such a high rate. We have a very high rate of our staff being vaccinated as well. And of course, the community does as well. But are you defining fully vaccinated as 2 vaccines, or have you moved to the CDC definition of 3?
Yeah, right now we're still at 2.
Okay.
You're exactly right. We are we're toying with that idea that we need to likely increase that. We have had a lot, just like Florence has said, we've had a lot of outreach, particularly to our own employees, though really emphasizing the importance of the booster vaccination. Right now, part of, I think what we're wrestling with is what is required, by the state and feds. And so we want to definitely stay in step with them and change as they change. I think I imagine we will be changing very quickly to boosting being the way to go.
Okay, thank you.
So if Commissioner Jacobson is done, I have a few comments, questions. First of all, I appreciated the opportunity to meet with you, Dr. Ogden, and Ursula Martinelli and talk about the STARS project. I think that's something that is critically needed by the county. And when I say by the county, I mean the county in general, not the organization. And certainly, I hope there's a way that we'll be able to provide some support for that project. Again, it's critically needed and would be of great value to many. So a couple of questions. Number one, is there a material difference between a KN95 and an N95 mask? What's the distinction, if any?
Yeah, there actually is. The N95 is, of course, the medical grade, and that is certified to be that 95% efficacious at stopping, viral transmission or particle transmission, because it can do much more than just viruses, of course. So the KN95 are those masks that are not as highly rated at that medical grade, but if you get a reputable dealer, not dealer, but a reputable manufacturer, I should say, someone that can certify, those masks can be up to that same level of efficaciousness, if that's a word.
Works for me.
Exactly. But I think you have to be very careful, because there are also those situations, because again, they're not medical grade, they're not made for the medical end user, that we have found that some of the manufacturers are not living up to that 95% blockage of those particles, coming in or out. So in theory, yes, they should be the same, but I think you just have to do due diligence and make sure that that you're getting that from a reputable manufacturer who's manufacturing to that level.
And how would we know that? i.e., do those manufacturers that meet those expectations or standards provide some kind of a certification, or is it just what you can kind of read on, I guess, internet or other media?
Yeah, I would have to ask our materials folks, like, how do they know that they are getting good, KN95s? I know that there's a lot of information out there on the internet about different manufacturers and, how good their products are. So I'm sure that they are accessing some of that information. I'm sure some of it is just their own knowledge and they're knowing sort of who are reputable manufacturers and who aren't, because we buy both. We have the N95s for our medical people, and then we have the KN95s available for non-medical personnel. So we do both.
Yeah, so a little due diligence in buying a N95 mask is probably warranted. So last question, and it's in a little different vein, but you are a medical doctor, and by the awards that you just got, doing a very good job, and I'll say a well-deserved recognition. I'd be interested in your comments, though, about the people that say, well, you know, the vaccinations, they're really not effective, or gee, they don't talk about all the serious side effects. And, you know, really, there's I guess, a negative flow of information out there that is really anti-vaccination, and clearly, at least in my opinion, the scientific data is quite to the contrary. But you're a medical doctor. I'd be interested in your comments on those aspects of the vaccination controversy.
Yeah, it's actually very disappointing, isn't it? Because
Exactly.
this what we have seen with these vaccines is we have seen a level of efficacy that we have not seen with any other vaccine. As good as our other vaccines ever were, this is crazy good. These mRNA vaccines, and I'm particularly referring to the two that are approved by the FDA, you know, in the United States, both the Pfizer and Moderna mRNA vaccines for COVID-19, that they have what some people consider very innovative manner of how they work. But in reality, this has been type of vaccine mechanism of action that has been investigated for the better part of 20 to 30 years, and just has been released to this level of distribution, you know, with this calling. I mean, this was the reason to use that technology, and we had it ready, and you know, the scientists had been working on it, and we have seen millions upon millions now of administrations of this vaccine with an incredibly low side effect rate. I mean, almost to the level of, and I know, of course, if a side effect happens to you, you know, it is meaningful, but it's almost to the level of being inconsequential of any sort of serious side effects. So basically, it is a shame that there is so much controversy about vaccines, because they have performed like any other vaccines that we have ever distributed, you know, in our medical history. So I can't say enough good things about them, and I cannot for the life of me understand why there is so much controversy about this, and why these have become political arguments rather than sticking with the scientific data.
So I guess in summation, would it be fair to say that you put your health more at risk by getting in a car and driving than by getting a vaccination?
Oh, every day. Oh my gosh, yes, 1,000 times over. 1,000 times over.
Yeah, but people don't see it that way.
No, because your chance of having a serious side effect from one of these vaccines is one in many millions.
Yeah.
And your chance of getting in a car accident on any given day is probably one in a couple thousand, maybe. Yeah. So just vastly different risk scenario.
All right. Thank you.
Mm-hmm.
One more call for questions, for comments for either Dr. Ogden or for Florence.
I guess one more comment, just to Dr. Ogden, as please let us know if you are approaching, the part where you're going to be having your, administration step in to do healthcare jobs. I think it's just helpful to know, where you guys are at with staffing and that sort of thing. Not that there's a whole lot we can do. I mean, I do have a full-time job as a commissioner, but, if we get to a point where we need administrators serving food or something, I'll be willing to help a day or two to just make that work. So just let us know, if you have to pull that trigger.
Well, thank you so much, because again, I'm with you. If we got to do it, we got to do it. And there's no job that we will not do in order to make sure that patients get taken care of. So, so I will definitely let you know if we start deploying our corporate workforce, and if we're out there doing it ourselves, because we may get there, but we're hoping for some relief, likewise from the OHA, to see if they can provide that for us.
Great, thank you.
I have another request. Would it be possible, at least maybe until this surge passes? We appreciate the generosity of your time today, but even perhaps submitting a very brief report on staffing situations at both facilities that perhaps could be incorporated in the weekly county update?
Oh, absolutely. Absolutely. I maintain a lot closer relationship with Florence and Jane than I think we ever thought we would have. And that is not a bad thing. And certainly I'm more than happy to make all of that information available. We're all in this together. And that's what I love about this county is we really link arms and we make magic happen when we need to. So I would love to keep you guys even more informed.
That would be great because, I think understandably there is a lot of public concern these days. And I think information is the best way, answers to questions, the best way we can assuage people's fears. So thank you. Anything else from my colleagues for Florence? All right, then we'll say, Florence, thank you for your report as well. And now we will move on if there are any commissioner reports. Commissioner Jacobson.
We have a report from the sheriff.
Oh, wait a minute. I'm sorry. That's right. The sheriff was also on the agenda. My apologies. And Sheriff, are you, the way it's listed on the computer, on the agenda, it's also under the COVID banner? Do you have something COVID related for us or something else?
Something COVID related, unfortunately.
Okay.
Good morning, commissioners. Thank you, Chair Hall. For the record, Curtis Landers, Lincoln County Sheriff. And yes, I wanted to be under the COVID report section because unfortunately I have some bad news from our jail regarding COVID. And within the last week, we've suffered a pretty significant surge in our outbreak in our jail. Began last week on January 19th, where we had 4 of our adults in custody display experience symptoms related to COVID. They all 4 tested positive. We moved them into the isolation area. As you remember, we have 8 cells identified for isolation for COVID patients. And then we tested the entire group and found that over the course of the week, we are up to 25 adults in custody. And also more significant, or not more significant, but just very significant, 10 staff members, 10 corrections deputies have also tested positive. That's 10 out of about 35 deputies that work in the jail. Over the last week have tested positive. So obviously that had us scrambling and with the overfill of our designated area to hold COVID patients, we basically, and the 25 that we did have test positive were all from our medium security E-pod. So it was contained into one pod. So we went to basically locking everybody down, separating them into areas. Lieutenant Russell and her team did an excellent job working with public health, Dr. Long, our facility physician, and the state to determine, what do we need to do. We were either releasing a large number of adults in custody back in the community, or finding other ways that we can isolate and lock down. They came up with a very good plan. It's not ideal. It's ideal, I think, for keeping them safe from spreading COVID any further, but not ideal for the fact that, our adults in custody are locked up most of the day with very little time to come out of their cell, to shower, contact friends and family, do what they need to do, which makes everybody a little upset in the facility, as you can imagine. But they do have a plan. We're hoping we're at the top of the curve for COVID. We'll be testing everyone again, it's my understanding, on Saturday, or as needed if individuals develop symptoms. We're continuing doing our cleaning protocols, everything else that we need to do as far as we've increased, as Dr. Ogden showed the wearing the N95s, how much more it improves. We've gone to the N95s, the non-fit version for that in our facility. With our staff working in those areas that with the COVID patients, we have all the protective equipment that we need to go in there. So yeah, I just wanted to report that to you so that you have that information. Again, I wish I had better news. Hopefully next week we'll see a significant decline in the spread. And again, I just want to thank Lieutenant Russell and her team for working in those conditions and coming up with a plan. She's been working very nonstop on addressing this issue. If you have any questions, though, I'd be happy to try to answer them.
Yeah, I have a question. I hadn't heard this, so really unfortunate. So two questions. One is, have any of the adults in custody or staff for that matter needed a higher level of care? Or are we all still doing okay in terms of symptoms?
No, good question, Commissioner. I should have covered that. No, everybody is just, no one's gone to the hospital. No one's had to have any higher level of medical care than what we can provide here at the facility or what our deputies can do for themselves at their homes. So I will say too, I know the question came up and before it's asked, out of the 10 deputies that tested positive, just one of them did not have any vaccination. All the other 9 had some form of vaccination, but not all of them were the full 3 boosted in the whole thing, kind of, but they did have the 2 shots.
Thank you. So my other question was, with that many staff out, kind of similar to the conversation we just had with Dr. Ogden, how are you managing with that number of staff out? And I know we were already down several staff members that had, moved on to other positions or what have you, and trying to hire. So how are you making this work?
Lots of overtime for the ones that are healthy, unfortunately. Have been filling in and doing that very well. Today, we start actually getting staff members back who initially tested positive. We're able to bring them back with negative tests and no symptoms. So while we've had 10 over the week, it wasn't like I don't think we've had 10 out, but we're going to start actually come out of that now and start bringing staff members back as they tested positive. They didn't all test positive all at the exact same time. So that's going to help too.
Okay, thank you. Thanks for letting us know.
You're welcome.
Commissioner Hunt, anything for the sheriff?
No, I again, just let's see, am I muted? No, I'm not.
Nope, we can hear you.
Okay, I got an alert on my screen. So no, I just appreciate the update from the sheriff. Certainly share the concerns about the health of our employees as well as the adults in custody, and let us know if there's ways that we can provide additional support as we all work together to manage the challenges that the pandemic is providing. Thank you.
Thanks, Commissioner.
Thank you, Sheriff. And now we're wrapped up with COVID reports, and certainly a sobering day in many ways, and just really drives home the point. If anybody thinks we're out of the woods with this pandemic, even though we're almost 2 years in now, that's not the case at all. So, do we have any commissioner reports?
I'll let Commissioner Jacobson go first.
All right, thank you, Commissioner Hunt. Yeah, I just wanted to report that Last night, we held our Fishermen Involved in Natural Energy Committee. That's an advisory group of local fishermen that are appointed by the Board of Commissioners. It was a group that I helped kind of organize and run back in my previous role with Oregon Sea Grant. And the group had one time met, monthly to provide information to the Board of Commissioners and then Commissioner Thompson, and kind of been on a little bit of a hiatus for various reasons for the last few years. We met for the first time, and I think in a year and a half last night, and started re-engaging the group in conversations around offshore energy, and also received an update from the PacWave project, which is the wave energy project that the cable was installed for earlier on this fall and summer. So anyways, just want to say that group is re-engaged, and our next FINE meeting is February the 22nd at 7 p.m. and we are meeting virtually.
Commissioner Hunt.
All right, well, on Monday, I participated in the virtual meeting of the different county representatives relative to the Association of Oregon Counties and the Oregon Department of Justice efforts to either renovate or build new courthouses. Our county was one of 6 that presented a case for building a new courthouse. And out of that process, there will be a prioritization meeting on March 8th, I believe, March 6th or March 8th, where the prioritization of funds that are available through the state that require matching funds from the counties would be prioritized. The good news is that our courthouse, relatively speaking, is not the most seriously in need of renovation or replacement, but a couple of 3 studies that we really need to do in the very short term in order to clarify our needs and therefore help in the prioritization would be to look at the 2007 seismic study, which at the time indicated, again, that there were some risks and issues, but I don't believe that study accurately reflects the renewed or the better understanding of the Cascadia event. And so therefore, I think an updated seismic study might actually show that there's a greater risk of seismic failure to our courthouse than was identified in that 2007 study. We also need to do a study that would look at the needs. What are our space needs in the courthouse? What are the costs for different construction and different configurations? And how do we build the building that meets the needs and is cost effective in its design, as well as meets the higher seismic needs. And finally, we probably need to do some kind of a study that looks at how would we finance all this. The county is looking at a lot of different projects, the animal shelter, the commons, a wellness center for consolidating our health and human service operations, and potentially, I think, relocating the sheriff's office out of the jail building. There has been some discussion recently about creating some kind of a quad, which has some attractions. And anyhow, so lots of information and lots of additional data that needs to be gathered as we move forward in replacing the courthouse. So just an update from the meeting on Monday and some future actions that we'll be taking.
Well, I would share that the last few years, the state of Oregon, through the executive and legislative branches, has really started in a big way to play catch up in trying to meet affordable housing needs around the state. And even though that funding is at record numbers, we know that there's still a long way to go. And with the legislature about to convene in their even numbered year short session, the governor's office asked Oregon Housing and Community Services to submit a package for $400 million in additional investment on top of the record levels that have previously been funded. Roughly 339 million of it would go to directly address the lack of quality, affordable housing around the state, an additional 25 million for homeowner support, and 35 million for asset building, individual development accounts. So, we'll see what happens. Anything can happen in the legislative process, as anybody who's spent any time interacting with it knows, but it's encouraging to see continued momentum toward trying to ensure every Oregonian a safe, decent, and affordable home. So, Casey Miller, Public Information Officer. Let's check in with you for constituent input, whether we had, my understanding is we didn't have anybody sign up for Zoom testimony under public comment.
Actually, Claire, I do
do?
believe, yeah, we have
Okay.
an individual here, Gary Lehman. And so,
Okay.
Gary, what I'm going to do is unmute you. So you should be able to, we should be able to hear you now, Gary.
Hello, can you hear me?
Yes.
Yep.
Good morning, everyone. I just wanted to let you know that I listen in to most of your meetings. Particularly, I like to hear the reports from the Public Health Department. And it was interesting today that we also heard from Dr. Ogden and Sheriff Landers. I just want to make an observation, and I'm sure you all know this and have thought about it, but we've basically had 3 different kinds of COVID-19 virus now. The native, the Delta, and now Omicron. And each of them have a different level of severity as far as severe outcomes. And each of them have a different level of what one might call immunogenicity. So now when I get these reports and I look at all the data, I think to myself, what does this data mean? Because we're really looking at 3 different types of viruses or different kinds of apples and oranges. So to look at the numbers is kind of confusing to me. But one observation I've made lately is that I still see people in public places without masks. And I note that when I go to the hospital, which is a private institution, there are employees there that check me as I go in and require me to do certain things. And if I don't have a mask, they require me to wear a medical grade mask. Yet when I go to a grocery store, I sometimes have been exposed to people without masks, and there appears to be no one there that enforces a mask policy. And I understand why grocery store employees don't want to and are not required to enforce that policy. Yet I wonder, the commissioners, as the ultimate healthcare authority in our county, if you have considered at least somehow helping these private institutions, and I'm mainly talking about grocery stores and employers with large populations that work in a congregate setting, to help them enforce a mask mandate. And I think this is becoming more and more critical as we have the Omicron, which is more and more contagious. Maybe if we had like just an auxiliary officer in a uniform standing at the door to intercept people that aren't wearing a mask and offer them a mask. One reason this is interesting to me, and I'd like to bring it forward, is because we're coming up on a time when it's going to be spring break. And anecdotally, I know from spring break time, we get lots of people from Montana and Idaho and out of state. And they don't wear masks. And I see my 3 minutes is up. Thank you, Casey. And that's all I wanted to bring up is that idea about having enforcement help at the various locations.
Thanks,
Thank
Gary. Casey, what about written input through our smart sheet? Do we have any new input since the last meeting?
Claire, I am going to show you this, but no, we do not have any input that is written. So no. And that would conclude, I think, our public input. I see no one else. Thank you.
So Casey, just a quick reminder for folks, if they want to do live testimony, as Mr. Lehman just did, what's the deadline for them to sign up prior to the meeting?
Well, there really isn't a deadline. So somebody could sign up as soon as you announce that on the agenda. So they could come into a meeting, 20 minutes into a meeting and still provide verbal public input through the Zoom platform, which is on our website.
Okay, and then for the smart sheet, isn't it, I think, 2 hours before the meeting, we asked people that testimony submitted up till that time to guarantee that it be included in the packet for that week. Okay.
Would appreciate that. Thank you.
All right. Anything else for the good of the order? If not, we'll remind people that, next week is, we're looking at Monday, January 31st, the office staff meeting agenda setting for the BOC will be at 9 a.m. conducted virtually. And then our public business meeting will be on Wednesday, February 2nd, and also being conducted virtually. So until then, thank you, everyone, and we'll